All right, let's talk about something important today. Trimix. It's a really powerful treatment for ED, but you've got to handle it with care. So let's dive right in.
So let me ask you something. Are you one of the many guys who's tried the pills for ED and just nothing? It's beyond frustrating, I know. And believe me, you are definitely not the only one dealing with this.
But here's the good news. Just because the pills didn't work doesn't mean you're out of luck. Not at all. There are other really powerful options out there when the usual stuff just doesn't cut it.
And one of the most effective of those options? It's a medication called Trimix. So let's break it down. What exactly is Trimix?
Okay, so Trimix is an injectable medication that you can only get from a doctor. It's a mix of 3 different ingredients that, well, work together to get blood flowing right where you need it. Since you inject it directly, it completely skips your stomach, which is a huge reason why it can work so well when pills have failed.
So how does it actually work? It's pretty straightforward, really. That direct injection tells the muscles down there to just relax. When they relax, the blood vessels open up wide, letting a whole rush of blood in. The result? It's usually very fast and, well, very powerful.
Okay, but we have to be real here. With this kind of power comes some serious responsibility. You absolutely have to know the risks. And this is why having a doctor guide you through this isn't just a good idea, it's non-negotiable. It's essential.
And here's a big reason why. Get this, almost 30%. That's nearly 1 in 3 men who use Trimix have some kind of side effect. Now, I'm not saying this to scare you off, but you need to go into this with your eyes wide open.
So what are we talking about here? What should you be on the lookout for? You know, some things are pretty minor, like a little pain or bruising where you do the injection. But there are more serious things too, like feeling dizzy, or even scar tissue building up if it's used too much. And here's the big one, the one you really have to pay attention to. A painful erection that just won't go away. That's called priapism, and it is a true medical emergency. You need to get to a doctor, like right away.
Okay, so after hearing all that, the good and the bad, how do you decide if this is right for you? It's simple, really. There is only one safe way to figure this out, and that's by talking to a doctor.
Let me be crystal clear about this. Trimix is absolutely not something you mess with on your own. It's not a do-it-yourself project. Trying to use this stuff without a doctor's supervision is just incredibly dangerous. You could cause serious, permanent damage. Please, don't even think about it.
But look, the great news is that getting expert help is actually really easy. If anything we've talked about sounds like it could be the answer you've been looking for, your next step is simple. Have a totally private chat with a medical pro. Someone like Dr. Kumar can sit down with you, talk about your health, what you're hoping for, and figure out a plan. It is, without a doubt, the safest and best way to see if Trimix is the right move for you.